Researchers are getting more information about the connection between traffic on I-93 and health problems in surrounding neighborhoods. The community-based research is being done in partnership with local universities and public agencies, and it's known as the Community Assessment of Freeway Exposure in Health, or CAFE. To bring us up to date are a professor of public health and community medicine, Doug Brugge from the Tufts University School of Medicine, and the co-director of the Chinese Progressive Association, Lydia Lowe. Thank you very much for being with us.
Thank you.
I want to start with Lydia because you work with people in Chinatown and Boston. You can't see the road too much these days, but you're pretty close to it, and I guess they're inhaling it.
Yeah. I mean, I think for years we've always suspected that it wasn't a healthy, thing to have Chinatown and a lot of housing right there next to the highways. But we never had any scientific evidence of that. And that's why we partnered with Doug and others, groups in Somerville, to do this extensive study that actually, interviewed and tested the air and, took down a lot of data of where people are and showed that there actually is this clear correlation between exposure to ultrafine particulate pollution in the air and cardiovascular risk.
Well, to give you a sense of what that's like for people who live in the neighborhood, we're going to bring up an excerpt of this video that was produced by the research project.
So this is the background site for Chinatown. This kind of gives a sense of what the regional air quality is. They also do blood tests and health surveys so they can compare the biomarkers to people who are constantly being exposed to near highway air pollution too.
呢個研究係好啊！呢個人人都需要，呢個社會需要，國家需要，環境需要，所以人人咧都話呢度好啊，空氣好啊咁，我根本覺得唔好。你好似而家咁，好似我哋呢度咁啦，你朝早抹乾淨啲玻璃，到晚黑翻嚟咧好多塵㗎。
Doug, talk about the problem that gentleman from Chinatown is alluding to. We're not getting the scientific terms. What's going on here? Because a lot of us, we can't even see what's in the air, so what's so bad?
So people who live near highways or heavy traffic frequently see some deposition of soot, black particulate on windows and windowsills and places like that. And I think that's what he's seeing. Our concern is ultrafine particles, which actually are a different component of the exhaust and the air pollution that are invisible and would not leave a residue that's so noticeable as that.
And the health problems that result from this, I at first thought they would have been respiratory, but actually maybe it might be something else that you're concerned about.
Yes, so most people think of air pollution, breathing it in, affecting the lungs. They think of asthma, maybe they think of lung cancer or some other respiratory problems. And those are true, those are problems that we're concerned about. But our study focused on cardiovascular effects like heart attacks and strokes. We didn't measure heart attacks and strokes, but we measured risk of developing those things. And actually the cardiovascular effects are larger in terms of mortality and morbidity long-term than the respiratory effects when you look at air pollution.
Lydia, what do you know about the population in Chinatown as far as some of the health risks?
I actually don't have a lot of data on
well, even
health,
anecdotally, what you hear people telling you.
I mean, I think that a lot of people don't think about the pollution here because they come from China, where pollution is really bad. And actually what you hear a lot of Chinese immigrants say is, oh, that the air here is so good, because they're comparing it to, Guangzhou or wherever they came from, where, they really see a lot of, gray.
It's hard to see anything in some of those cities. Right?
Yeah, but, but we think that, it does have an effect. I mean, we have seen, again, the focus of our study wasn't on respiratory, but we have seen, a higher rate of asthma among children at the Quincy School. People have, in our study, showed, slightly higher risk of inflammation things like that.
Doug, talk about the full range of the study, because there's a lot more to this in Chinatown. You start pretty much farther south and you go farther north too.
The study was actually initiated by community people in Somerville who approached me about the issue, and then once they convinced me that this would be something worth looking at, we went to Chinatown and to Lydia and asked if they were interested, and they joined on as well. So the study started in Somerville, then moved to Dorchester and South Boston, and then to Chinatown, and those were our 3 study areas, 1 year in each area, recruiting people, measuring the air pollution, and that constitutes the core of the data collection on which we were able to do this analysis that we've reported recently.
This looks like as if it could even have national implications, because there are a lot of big cities with highways going through them, a lot of dense populations. So where do you see this going?
Yes, I think there are national implications, although a local study tends not to drive national policy. But the US EPA is currently reviewing their particulate standard. Today, ultrafine particles are not included in the federal regulations for air pollution. I think they will probably not add ultrafine particles at this time. I think probably the scientific evidence is not strong enough for them. But our study, along with a few others, I think are beginning to build an evidence base that is likely to move them toward having to take the issue more seriously in the future.
But generally, air pollution is recognized by the World Health Organization as one of the leading causes of morbidity.
Well, I think the thing that's going on is that the people who live in the neighborhood with this, they're going to be most affected. And is there something that you need to do to the housing to buffer them at least?
So that's what we're really focused on now is, you know, it's great to know that this is a problem, but what do we do about it? And we have been working with developers in Somerville as well as in Boston to look at putting higher quality air filtering systems into the air handling, of a building. And that, has been shown to actually remove a lot of those particles from the air. We're also looking at open spaces because, Chinatown's main open recreational space, the Reggie Wong Park, actually lies between a highway on-ramp and off-ramp. Probably one of the most unhealthy places in the city because not only is it there, but it's at the location where a lot of the exhaust from the tunnel, from the central artery tunnel, comes out. So we're also looking at, are there ways to design that park that could be somewhat protective of the pollution, of the people in terms of the pollution.
Right, this looks like it's an expanding concern because we've got transit-oriented housing under construction in Dorchester near I-93. We have the Ink Block and the other developments around it in the South End. There was talk about Widett Circle. I mean, this is all cheek by jowl with I-93.
Yes, I think that the current development paradigm, which is smart growth or transit-oriented development, tends to move people closer to traffic, especially highways and major roadways. And so I'm at least not opposed to building housing in those locations, but I think it should be done in a way that's protective, including, as Lydia was saying, putting in strong filtration systems in the ventilation. And I truly believe that if you do that from the beginning in the early design phases, it's not that hard to do. If you build the building and it's an afterthought, that's going to be costly and more complicated. But if you plan it from the start, I think it's quite a doable thing.
So actually the city of Somerville is considering zoning language that would require this kind of air filtration system in housing that's near the highways. And I think that's really what we ought to be looking at in the future.
Thank you both very much, Lydia Lowe and Doug Brugge. And by the way, if you'd like to see more of that video, you can do a search on YouTube at Highway to Health. Up ahead, political strategy for closing the gender gap. We'll hear about a new connection between academia and the State House.